Thank you for tuning in. My name is Tiffany Edwards. I am the Director of Program Operations for the Metropolitan Chicago Breast Cancer Task Force. The task force is a nonprofit that addresses cancer disparities largely in ethnic minority women. If you want to learn more about the task force, here is our information. We are located at 300 South Ashland Avenue, Suite 202, Chicago, Illinois, 60607. And our phone number is 312-942-3368. Feel free to visit the website. It's www.chicagobreastcancer.org, as well as any of our feeds on social media. That includes Facebook, Twitter, and Instagram. You are watching a live call-in program, so I invite you to call in with questions. The phone number here at the studio is 312-738-1060. I am pleased to have in studio with me today Dr. Catalina Lawson. Thank you for joining me.
Thanks for having me.
Dr. Lawson is a clinical psychologist at Rush University Medical Center, and today we will be talking about mental health and sort of coping with cancer. So Dr. Lawson, you are a clinical psychologist. For those viewers who are not aware of that field and kind of what that particular role is, can you tell them a little bit about what you do?
So I'm what they call a clinical health psychologist, and Rush is actually, and I work at Rush, and Rush is actually one of the one of the oldest hospitals in America that has actually had clinical health psychology. So what clinical health psychology is in addition to being a clinical psychologist, we specifically work with individuals with chronic illnesses and their families. So individuals impacted by cancer, heart disease, HIV, long-term chronic disease.
Okay. What can clients expect when they come to see a psychologist, a clinical psychologist?
You know, there's a lot of assumptions about psychotherapy, and a lot of people get very nervous, understandably, to disclose to a stranger about themselves or about a problem that they might have. But the reality is actually much more relaxed. When a person first comes to a psychologist, basically the goal is for the psychologist to understand what brought them there and to begin to build their therapeutic relationship. So a psychologist is going to ask a patient what brought them in, how this concern has been impacting their life, their functioning, their relationships, as well as what they've tried to actually resolve the problem, what worked, what didn't. And then this is all an opportunity to get to know that patient and also figure out how to communicate and how they might work together. So the first session isn't a typical therapy session in that a psychologist probably is going to be asking more questions and not necessarily sitting back and listening as much. But it's not daunting. It's very relaxed.
Nice. You work in the medical center, which is what I mentioned earlier, that you're at Rush University Medical Center. Do you have a particular specialty?
I do.
Okay.
So I am what they call a psycho-oncologist. And not many people know what that is. It's like, so what, you're psycho, but you're an oncologist. So basically, psycho-oncology is an area of psychology that specifically looks at individuals impacted by cancer. So my role on the medical team is really to help patients and their families adjust to cancer. So I work with patients throughout the cancer process, anywhere from when they're initially diagnosed and adjusting to that, coping with the cancer treatments such as chemotherapy, radiation. Unfortunately, those often come with a lot of side effects. So I help patients manage those. Also, after cancer treatment ends, I help patients figure out how they want to, what is their new normal, how they want to see themselves, what roles do they want in their work and their relationships, and how to adjust to that transition. And I also work with patients and their families at end of life. So as a psycho-oncologist, we work throughout the cancer continuum.
Okay. You mentioned that you work as part of the team. So for some patients, you would be part then of their medical team. What what distinguishes you from the other physicians that are part of their medical team? Like, what might make their interaction with you different from their oncologist or from their primary care doctor or other physicians?
Okay, that's a great question. So at Rush, our cancer center really has an integrated approach to treatment. And as part of that, I'm a member of the multidisciplinary teams, which means that when an individual is diagnosed and treated for cancer, they're going to meet with a lot of specialists, including, as needed, a psycho-oncologist. So what my role is, and how it's pretty different than other roles on the team, is that really patients talk to me about maybe with the more sensitive things that they don't feel comfortable talking about, maybe with their oncologist or their nurse. Things such as fear of what the diagnosis, the fear of dying, worry, anxiety about the actual treatments and getting through those treatments, impact on relationships. So the oncologists are generally treating the patient to keep them alive. I'm working on the side of their life that makes life worth living.
Okay, so you're focusing on their mental health and their well-being and quality of life issues. It looks like we have our first caller. Caller?
Hi, my question is, when you have a family of like more than one child, do you recommend that once you finally sit down with your family and tell them that you've been diagnosed, that it be an individual conversation with each family member, or that you sit everyone down together?
I think that's a great question, and I've certainly worked a lot with families with kids for all different ages. And really this is a very individual, and parents need to decide these questions, how to disclose and talk to their kids about cancer. The first important thing to remember is whatever conversation you're going to have, that it is age appropriate. So this assumption that transparency is complete, always should be super honest, it really depends on how emotionally mature your kids are and what they can handle. And so parents really need to gauge that to figure out, first and foremost, how much do they need to disclose and how involved do you want the children to be in the treatment process. For instance, how do you want them to come to doctor's appointments, or do you want to give them, what types of updates do you want to give them? And again, as far as whether or not these conversations should be individual or as a family, that really does depend on the emotional maturity. If there's a big gap between siblings, oftentimes, children know when things are different, particularly if mommy and daddy or mommy or daddy are sick. And so they kind of already have some hunches. And so really starting off, generally, most parents take the approach, and we recommend to start with the older kid. And again, as you're disclosing, assess your child's understanding of what you're saying and tempering it. Not everything needs to be told in one conversation. So really not feeling the pressure to have to disclose everything all at once, but really making it a conversation.
That's a great question, caller. Thank you. Along those same lines, so you work in the medical center and you deal with patients. Do you also offer any services for their family or for loved ones or for caregivers that might be coming to the appointments with the patients, that might be there with them throughout the course then of their treatment?
Absolutely. Unfortunately, with cancer, oftentimes we see caregivers, particularly if this is a spouse or a daughter or a child, an adult child of a parent with cancer. Oftentimes we see the caregivers and the family members experiencing more distress than the patients themselves. Mm-hmm. And the theory behind this is that during cancer, patients are actively involved. They are doing something. They have to get through the treatments. They have to go and do all of these things, whereas it's generally the family members and the caregivers that just have to sit back, and the only thing they can do is try to offer as much support as they can from the sidelines, but they have to watch all of this stuff happen. And so it's pretty common that caregivers will experience significant distress. And so certainly we provide couples therapy, or we just will work with the caregivers or family members, as well as do family therapy. Certainly I've worked with families to address, do some end-of-life planning to help families all cope and really understand the implications of that cancer diagnosis.
Yeah, it's really interesting. Kind of with that same thought, What are some of the other opportunities that you guys have at the medical center for patients, but also families, like some of your resources, and what are some of the services that you offer within your department and the Cancer Center?
Okay, so within the Cancer Center at Rush, we have, the section I work in is called the Psychosocial Oncology and Cancer Integrative Medicine Program. And this is on the 10th floor of our professional building and part of the Cancer Center. That said, so while we primarily see cancer patients, we also certainly see individuals who have heard about our services, and we welcome individuals from anywhere, even if they're not receiving cancer treatment at Rush. So at our clinic, we offer individual, couples, and family therapy, psychotherapy, as well as acupuncture and massage therapy and nutritional counseling. So again, going back to this idea of providing integrated care, really not necessarily only seeing these, traditionally, or back a couple decades ago, we used to see psychology and acupuncture, all of those things, as complementary, but really, it's actually part of care. We make sure that patients can tolerate and cope effectively with the cancer treatment so that their quality of life from diagnosis moving forward is also as good as it can be.
Do you find that patients really take full advantage of those services, like the acupuncture, like the massage therapy? Those are really
Yeah, no, for
vital
sure.
services.
We've been really fortunate to, at our clinic, receive, I think now we're going probably on our third or fourth year of receiving funding from the Lasky Foundation, which is a nonprofit. And they actually support a lot of our acupuncture and massage services for patients, where they can get up to 3 free sessions, either the patient or their family members. And again, particularly during therapy, during cancer treatment, these become really valuable for patients. With pain, with fatigue, nausea, those types of things.
Just stress in general, I would imagine.
Oh, absolutely.
The stress of a diagnosis.
Yeah. Well, and also for the family members, while they're
Yeah.
waiting for the patients in infusion or in radiation, oftentimes that's when they'll use some of those services.
Yeah. Why is it important for patients, for clients, for family members to really not only focus on their physical health, because clearly they're oftentimes dealing with a pretty significant medical illness, but so they're focused on the body aspect and their physical health. Why is it important for them to also focus on their emotional health and their mental health kind of throughout this process, both the patient and family, friends, caregivers, etc.?
Well, the reality of health now is over the last few decades, we've really been trying to look at health not only as the absence of a physical disease, but really balance amongst our physical, emotional, relational, and social aspects of our life. And that's really the definition of health. So inherent in that model, looking at cancer as a good example, really what we're looking at is cancer is a chronic illness that faces a lot of us, but cancer doesn't happen in a vacuum. The reality of cancer is that it happens, but life is still going on. So for example, when individuals have a cancer diagnosis, but say maybe they've been having problems in their relationship or in their marriage or with their children, those problems don't just cease to exist. What we have to figure out and support patients with is, okay, how do you deal with those problems, figure out those, hopefully, and use the cancer as an opportunity or a time to actually prioritize some of those issues, but also, in the meantime, get through your cancer treatment. So the reality of cancer and any health illness, or particularly a terminal illness, is that it doesn't just affect your physical body. It affects how you see yourself, how you relate to others, whether or not you can work. Generally, it's life-changing, particularly with these life-threatening illnesses. And so it's really important to look at how cancer impacts and address and support how it impacts an individual and their family, both emotionally, psychologically, and socially.
Can you talk a little bit about what are some of the common ways that patients may present to you? Because I think oftentimes there's this misconception that you see a psychologist when you're at your wit's end, kind of you can't take it anymore, you have no more coping skills left, you're just kind of at the very end. But that's not even oftentimes really the case. So can you talk about what are some of the common presentations, but then maybe also touch upon for anyone that might be watching, maybe times where it would be good and maybe to their advantage just to talk with someone, that you don't need to always be at the bottom of the barrel when you reach your wits end to kind of see a psychologist or see anyone in terms of coping and skill development.
Well, and I think that's a really good point. I mean, I do think, unfortunately, in our medical system and with insurance, we're often reactionary. We wait until there's a problem to actually address it. And particularly when patients are faced with their cancer treatments and having to get all these scans and multiple doctor's visits. Unfortunately, the psychological, social sides do tend to take a back seat. But they're critical points, generally, where research has shown where distress occurs. Generally, upon diagnosis, patients are going to experience distress. That's going to be within a realm, though. And we expect some distress then. But that certainly gives an opportunity to help support patients. What you find is that the majority of patients once diagnosed, actually pretty much are about 60-75% of them are actually going to be okay because they actually need to immediately make a lot of decisions. So the madness and the chaos of that actually doesn't allow a lot of time for patients to process a lot of what's happening to them. So as you see patients going further on into therapy, next thing you know is you're dealing with the side effects of that therapy, whether it be chemotherapy, radiation, or surgery. You're dealing with the physical side effects of that, which also take their emotional toll. So that's another critical point. And then after therapy ends, this is where patients now are just waiting. They're waiting to see how this therapy went. And that actually, one of the fear of cancer recurrence has been shown to be one of the most prominent worries cancer patients and their families have. And so that's another critical time and a massive transition for cancer patients and their families of figuring out, okay, now what? We went through all of this, but now what? What does this mean to me? What does this say about my life? What do I want to do with my life now that I have a life and I want to move forward? So that's a pretty critical time. And then of course, end of life and supporting patients and their families during that. So the thing is, though, is that when patients start feeling a good time to actually identify within yourself is anytime you're feeling a bit overwhelmed. When we're feeling stressed, basically we start to change how we act. So for instance, maybe when oftentimes patients can't sleep. Sleep is a major problem amongst cancer patients because they're worrying. They're worrying, okay, maybe what's going to happen to me? What am I going to do with this or work or my families, my relationships? So the next thing you know is they're not able to sleep for hours. I mean, they're only sleeping a couple hours a night. What happens in cancer treatment is because it's so long, it offers a lot of opportunity for this now initial, just one time, a couple times, to now insomnia to develop as a habit. So as far as patients identifying when a good time to coming in is really at those early stages where you start noticing that something, the way you eat, the way you are sleeping, maybe you find yourself withdrawing from or saying no to social activities. When you start noticing those changes to start, is a really good opportunity for you to maybe just take the space and take that opportunity to get support.
Now you're in the medical system, which is what I mentioned earlier, and you're doing clinical work. Do you also do additional work? Like, do you do research? Do you teach? Okay.
So I am an associate professor at Rush in the Department of Behavioral Sciences, and as part of my role, I do clinical work with cancer patients and their families. I also teach medical students as well as psychology trainees. And then I also do research, and I specifically look at cancer populations and looking at quality of life in cancer survivors, as well as I do some work in health disparities and global health.
Okay. Can you talk a little bit about one of your research studies for viewers that might be interested?
Yep. So I have two areas of research. One is looking at how we can actually apply what we do here in America to lower income, low resource settings, such as Vietnam or Bhutan, more in Southeast Asia and South America, to really look at how in low resource settings we can actually still address psychosocial concerns. The other area of my research looks at quality of life amongst cancer survivors and their partners, specifically with regards to sexual concerns. Unfortunately, after cancer, anywhere from 40 to 100% of cancer survivors can experience sexual changes. And this not necessarily just only has to do with intercourse, but it can also be changes as far as their libido or their sense of body image and their willingness to actually just have, intimate relationships. And so there's a lot of sexual changes that occur after cancer. So I've been fortunate to actually develop and test a web-based intervention that we call Rekindle. I did some of this work when I was out in University of Sydney in Australia, and now I'm actually just got funded to do more research in this area, specifically for Latina cancer survivors. So I'll be developing the first web-based resource to address sexual concerns amongst Latina cancer survivors. Because surprisingly, there's actually been no research in sex therapy in general looking at how we should provide Latinas sexual support. And so,
why do you think that is? Is it just a very understudied population because they're not participating in the research studies, or just wasn't seen as an area of focus and need for so long?
It's interesting. I was surprised by that when I really started delving into this literature. And the reality is that most sex therapy research within cancer, with sex therapy is done on Caucasian college students. Most of them are done at universities. So if you look at most of the research in sex therapy. So then within cancer survivors, then most of the research is done with Caucasians. And so with Latinas, there's just been a lot of assumptions that either there's Latina sexuality is perceived as either Virgin Marys or they're a bit too sexual or over sexualized, and there's only these extremes, and so there's a lot of assumptions, and because of those assumptions, oftentimes with Latinas and other ethnic minorities, there's just silence. Don't ask them about it, and so because of that silence, Latinas don't get the support they need, and doctors won't talk to them about it. So I think that's really what's motivated me to want to look more at these sociocultural aspects of some of these quality of life or survivorship concerns, because particularly here in America, we are so diverse. And again, I see cancer as really an opportunity to, if patients are going to go through all of this, to have a life, relationships are what we live for.
Yeah.
And so I'm really a big advocate for figuring out, okay, how do we support cancer survivors and their partners to really improve their relationships after cancer?
So you're located at Rush and you see patients that are inpatient, but do you also see patients that might be going through cancer or dealing with a diagnosis, or they're a family member of a cancer patient? Can you see them as well? Or?
Yep.
Okay.
So we certainly see patients, in our section, we see patients on the inpatient unit. So when they are, for whatever cancer treatment, or if they have problems or side effects, we see them in the hospital, and then we see them as an outpatient on the 10th floor of the professional building, and an infusion, radiation, wherever they need.
So what I would do is just show the callers and the people that are viewing us now your information, and maybe you can kind of walk them through ways that they would be able to contact you if they're interested in resources or services that you might offer at Rush.
Thanks so much. Again, thanks so much for having me. You can certainly reach out to me either via email at Catalina_LAWSIN@rush.edu. Feel free to call me on 312-942-8709. Otherwise, you can look us up on the internet, and we are on the 10th floor at 1725 West Harrison.
Thank you so much. And for those of you, once again, that are interested in the Metropolitan Chicago Breast Cancer Task Force, then I'll show our information here. Once again, you can call us at 312-942-3368. Visit our website at www.chicagobreastcancer.org. rushcancer.org. You can view any of our feeds that are on social media at Facebook, Twitter, and Instagram, and feel free to email us at info@chicagobreastcancer.org. Dr. Catalina Lawson, I really want to thank you for being on the show today, and I hope that those that are watching were able to pick up on some really interesting tips. Do you have any last words or comments that you wanted to make?
Well,
to our
thank you so
viewers?
much for having me. This has been a great opportunity. I hope, I think that one of the big things that I'm an advocate for is really just starting the conversation that it's okay to ask for help. It's okay to ask for support. It's okay to want to take your life back, particularly when you're under and go through something like cancer. So feel free to give us a call or come by us at Rush, and we're here to offer us whatever support we can.
Thank you.
Thanks.